Real time, by the numbers, patient assessment trauma from the top. First things first, have my BSI. I want to check my environment, make sure everything's secure. Tally my number of patients, considering additional resources I may need. Check on my MOI or NOI and the extrication problems, and consider the need for spinal precautions. I'm going to come up, form a general impression of the patient. I want to come up, get his level of consciousness, using AVPU and asking person, place, time, event questions. I want to get the patient's chief complaint, look for any apparent life threats. If I find any, stop, manage them. I'm going to check to make sure his airway is open, clear, and maintained. If I need be, I will suction or insert an OP or MENT P to maintain it. I want to check his breathing, look, listen, feel. I want to know if he's breathing and if it's adequate. Based on those two questions, I'm going to apply high flow O2, be a non-rebreather or BVM. I'm going to expose the chest, looking for any life-threatening chest trauma. If I find any, stop and manage it. Check for a pulse at the carotid, skin, color, temperature, condition. Do a blood sweep, looking for any major bleeding. If I find any, stop and manage it. If you're showing signs of shock, I can elevate the feet, cover them with a blanket, and I already have high flow O2. Make my transport decision, load and go. Partner's making ready the backboard. I'm going to perform a quick head-to-toe rapid trauma assessment, looking for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, swelling. Feeling for tenderness, instability, crepitus, tenderness, rigidity, and distension, starting at the head. Looking for decap BTLS, feeling for tic, feeling for depression, checking for blood. Pen lights out, checking the eyes, looking for pearl. Nose and the ears, looking for blood. CSF, check the mouth for any potential obstructions. Palpate the facial bones. Palpate the cervical vertebrae, feeling for step off. Check for JVD. Make sure my trachea is midline. Measure and apply a C-collar. Inspect the chest. Palpate the chest. And auscultate all 4 lung fields. Palpate all 4 quadrants of the abdomen, checking for turd. Iliac crests, push inward, downward. Check for stability. Check the groin for major problems. Femur, knee, tib, fib, ankle, foot. Femur, knee, tib, fib, ankle, foot. At the feet, check for pedal pulses. Motor sensory function, checking out. Upper extremities, all the way down, looking at hands, thinking PMS. Check my pulse. Motor, sensory function. Now my partner at the head's count, roll the patient up on their side. Palpate the remainder of the spine, checking for any step-offs. Check the posterior thorax for any trauma. Get a board under him. Get him onto it. Package him up. Get him in the ambulance now that I'm on my way. I'm thinking sample history. I'm thinking vital signs. I'm thinking secondary wounds. Reassess, 3 to 5.